One to our webinar about 32Co's Clear Aligner Case Hospital. This is for people who perhaps have had a case gone wrong, to try and find out how you can get your future cases right first time, every time. So tonight we'll be talking about the Case Hospital, which we soft launched a couple of weeks ago, and quite a number of you sent us cases which didn't go to plan, either cases that you were struggling with at the moment, or cases that you'd done previously and you weren't sure what had happened and you wanted a specialist to talk to you about what you could have done differently. The second thing we're going to talk about is, for people who work with 32Co, the whole point of this is to prevent these mistakes from happening in the first place. So we're going to talk through how you can learn to get your cases right the very first time. And we have with us myself, Dr. Sonia Szamocki. I am the founder and CEO of 32Co.
And Professor Ama Johal, specialist orthodontist and clinical lead at 32Co.
Cool. So a little bit about me, for those of you who don't know me. We've built this concept, this company, around the premise that clinical excellence is achieved by giving general clinicians access to the world's best specialists. So I've seen all sides of healthcare. I've been in healthcare for about 20 years, both as a practicing doctor in the NHS, in primary care, in super specialist centres, on the outside in strategy consulting, doing big healthcare transformations, hospitals, for pharmaceutical companies, and also in health tech, seeing the latest innovation in medical devices and innovation using technology. So I really have seen it all. And to me, the thing that stands out from that experience is that, you know, the best care that I was ever able to deliver was through working together with specialists. And that is the future that we're building for all general clinicians. And we hear the same story from dentists like you all the time. Over 70% of dentists worry about clear aligner treatments going off track, causing refinements and due to patients not complying. And 57% of you worry about taking on cases that are too complex when it comes to clear aligner treatment. And why is that? Well, from the thousands of cases that we've done with you guys, it's been clear to us from looking at the industry that treatment planning expertise really has been stripped out by traditional manufacturers for lots of reasons, but cost being the primary driver. Endless refinements have just become the norm for you guys. You expect them to happen. And as a result, your cases just aren't profitable anymore. And finally, we know that all clinicians, you guys, want to understand the treatment that you're offering, but just the training that you're attending just isn't enough to fill that knowledge gap between what you want to achieve and the experience that you have in orthodontics. And that means that your case journey looks something like this. On the y-axis, it's your excitement and your confidence, and some of you will recognize this is roughly the shape of the Dunning-Kruger curve. And a lot of you bottom left have never done aligner cases before because of fear of litigation, worried that you don't have the skills in orthodontics to take on these cases and charge, you know, quite a lot of money to your patients for treatment that perhaps they might need, but you're not sure that you could deliver the results on. For some of you, you've come up the curve and gotten to that first case, and it can be really exciting at that point. You sort of got your first case in treatment. Maybe there's, you know, a couple of bumps along the way, but you get there. And then very often what we see happening is that those cases start to go wrong because of the problems that we just agreed, treatment planning, and that knowledge gap, and those cases start to go wrong and you lose all confidence. And many of you never pick up this work ever again, or are very careful with the cases that you select and really stick to the simple stuff. And for us, that is such a shame. So over to you, Ama.
Well, good evening, everyone, and welcome to this webinar. And essentially, picking up really from what Sonia has alluded to, working with us is really about avoiding those mistakes and that attitude about trial and error. We hope that working together with a specialist offers you more than what you could possibly expect. And what I would say really is, what we've demonstrated this evening is what mentorship is about. And essentially, you may ask, as a dentist providing clear aligner treatment, how is this going to be of any benefit to me? Well, firstly, we can offer you more predictable treatment plans, which ultimately means less refinement. And guess what? Better patient outcomes. better case selection and assessment, which is overlooked on many, many regards. And finally, I guess not to put least weight on, is that you get better consent, lower risk, which ultimately translates to you both professionally and financially. So the question you could ask is, how does our approach differ? Well, at 32Co, we like to think we've deconstructed completely the current traditional approach to treatment planning. We've created what we call the 32Co method, which is based all on clinical excellence and not on a cost exercise. In particular, the way that we achieve this is through two approaches. The first is that we have a very highly trained and specialized group of designers who have a significant skill set and experience in providing clear aligner treatment. And the second is we have a specialist group of orthodontists who have joined by invitation only and equally undergone rigorous training to adopt the common 32Co method. So if we revert back to this flow diagram that Sonia was showing, and that the experience sometimes poorly reflected to dentists, our objective is to get used to the second case, the third case, the fourth case, and your experience should be similar throughout the whole positive outcome.
So for those of you who haven't worked with us yet, one thing we do hear from people not using 32Co is that lots of cases do go wrong and people need help. And that's something that we do want to be able to offer. So as a result of people reaching out to us with cases that they really weren't happy with, we actually built something called the Case Hospital. And that's a way for non-32Co users to come to us and say, look, I've got a case that I am stuck with, and I really would like some help getting it back on track. Or I had a case that just went disastrously. I couldn't figure out what went wrong. Could a specialist walk me through this to make sure that I'm not making the same mistakes again? So the Case Hospital is a place where you can share some case details with us. A specialist will get on the phone and talk to you about it and essentially create a get well soon plan for you. So as I said, how did this work? So non-32Co providers submit this to the Case Hospital, and we will share some details on how to do that towards the end of the call. And that's 15 minutes of one-to-one advice, and that's for free. We are really here to try and help things go smoothly and to avoid those car crash cases. Obviously, for 32Co providers, our normal way of working is that you would submit a DO case and work one-to-one with a specialist orthodontist anyway. So that is to get that experience of mentorship and really avoid those problems happening in the first place.
So seeing is believing. What we've done in the Case Hospital is taken a number of scenarios from common clinical practice and experience from our dentists that have encompassed these problems: anterior tooth rotation issues, laterals not tracking, black triangles. So let's agree initially just on a couple of definitions. Assessment of case complexity. What we're really talking about here is determining this what we call an intersection between what is physically possible and what is safe to predict as an outcome. Improving the treatment plan and its accuracy with, importantly, fewer refinements. Or assessing, in this particular case, some of the mid-treatment complications, because let's face it, treatment isn't always predictable and things can go off track. And our job really is here to support you, as Sonia said, very much in this one-to-one environment, to get you back on track and get your patient that outcome they want. So we've selected some cases. Let's look at this first case. You'll notice from the dentist notes that the patient simply wants to align their teeth, which is a very reasonable request. And our colleague, the dentist, feels that this is a very suitable case, from a dental periodontal perspective. And if we look at the objectives, if you like, in treatment, essentially it's just to get some rotational control, but rotational control can be in itself a very challenging perspective for aligners, and to align and address those lower incisors. So what were the challenges that came up in this case? Well, it came very, very much to that anterior rotation and the planning that went with it. So we felt really that perhaps the appropriate level of movements hadn't been planned for, and consequently, the attachments were inappropriate. And what the dentists unfortunately found themselves is that they underdelivered in terms of alignment. Fundamentally, most of these issues, as Sonia alluded to, come back to that treatment planning perspective. So what was needed was further refinements, and therefore this always inevitably, if it's not planned for at the outset, is going to inevitably lead to patient dissatisfaction, and certainly from a dental perspective, it costs us time, energy, and money. So going back to what can we offer to you as a specialist? Well, we can basically mentor you and guide you through what we may feel is the most appropriate attachments, the need for space requirements, for example, IPR. And this patient journey would certainly have been very different had we been involved from the outset. So what does a good treatment simulation look like? So on the left, you can see an animation, and most notably, you'll notice that we replanned this case or refined it in 6 aligners to get the objectives, to finalize the derotations that were required with more what we would call appropriate attachments and a little bit of IPR. This second case really highlights a very tricky scenario that's often confronted by clinicians providing clear aligner treatment. Predominantly, this patient wants correction of the upper right tooth, and you can see it's rather anesthetic. It's in crossbite, it's palatally excluded, and again, the dentist is confident that this patient's good and suitable for aligner treatment, but stipulates at the outset they don't really want to do IPR and want some simple tipping movements. Looking ahead, this is what was planned for this treatment, and it looks fairly straightforward, isn't it? The lateral literally sort of drifts forward, so to speak. What I want you to just draw your attention to in particular is that when you look at the lower occlusal perspective, which will arrive in a second, you'll notice there's no disclusion of the arch at all. And that will have significant relevance to us or to the dentist in this particular case. So the issues that arose weren't just clinical concerns, they were patient concerns. This dentist basically hadn't planned or guided, let's say, to undertake any disclusion for the upper right tooth when it was going to come forward into crossbite. More importantly, the patient became very, very aware of that lower right tooth becoming hypermobile because of the fremitus effect of bringing the incisor forward and not discluding the teeth. And again, most of this arises from, in a sense, that the case complexity, but more specifically the plannings. So what was needed was, again, refinement and essentially a sort of an exercise in controlling the patient wants and the dentist's dissatisfaction with care. So we kind of planned this case and helped our colleague essentially in looking at how we felt that IPR might be required. How we could also help the patient from the outset. Had we planned this case, we would have identified for the patient and the dentist that there is going to be a premature contact arising between the upper right tooth, the lower right tooth, and therefore to warn the patient that, for example, aligner 10, that collision is going to happen, and therefore not to be shocked when they start to find there's a degree of mobility in the lower incisor. More specifically, we would encourage disclusion of the teeth to allow that movement to take place with minimal grade 2 mobility on the lower incisor. So let me illustrate. So here in the refinement, we're essentially focusing on what was needed in the upper arch. And it was a simple movement, but there you can see the lower arch is being discluded to permit that final movement. And we're pleased to say that in 12 aligners, the problem was solved. Let's look at this third case. A very interesting case, actually, in that the primary concern is really about leveling the incisor edges. And you can see the upper left central incisor is measly tipped and, unfortunately, has that rotation. The other thing you'll also notice is that its angulation. It's very narrow at the neck, very wide at the crown, at the tip. So therefore, when these two contact points come together, you can almost anticipate there's going to be a black triangular event. And unfortunately, no IPR was planned for this case. And it was also, interestingly, that the prescription incorporated horizontal attachments, and I'll come back to that in a moment. So what was the outcome? Probably not unpredictable. You can begin to see that the incisor didn't align very, very well, and it basically tipped itself against the upper right central and creating a sort of a dark triangle. And the issues really arose from, as we said, one, that the attachments not perhaps being the most appropriate that this case required, and secondly, the lack of advice given to the clinician, in this case, one of our colleagues, the dentist, in terms of the IPR need. And so additional refinements was needed and also some IPR. So let me show you what we jointly achieved. And that achievement, I have to say, I do like this GIF actually. It does make me laugh every time I see this. But essentially, putting a specialist into the equation allows us to have that second pair of eyes. So this is now two dentists planning a patient's care, and hopefully we can make that journey smooth and easy. And so we could see or preempt some of those issues, but most importantly, really improve your treatment efficiency. So the attachment design was slightly different. We incorporated a more optimal control of that upper left central, but more importantly, timely intervention with some IPR to minimize the black triangular space. And you can see the outcome in the end was pretty good and left the patient very happy. And of course, our dental colleague extremely happy as well, I guess, is the best choice of word. So let's look at one final case. And you might argue that this is quite a challenging case. It presents with a large diastema, an interesting crown form, and a lot of spacing in the upper arch, and some spacing present in the lower, which is always encouraging. Now, the patient naturally was asking the dentist, could this space be realistically closed? Again, from a clinical perspective, this patient was very suited to undergoing treatment. But interestingly, the dentist was provided their plan and advised that they needed what's called optimized attachments. And some of you may have come across these from one of the popular brands of aligner manufacturers. So if we just look at what was actually planned for this patient, you'll see that the incisors, everything looks quite well. So the lower incisors are retracted, which is good. The upper incisors are pushed together, but I want you to particularly pay attention to the design of the attachments placed on the upper central incisors, those two small optimized attachments at the mesial edges. And we'll come back to this feature in a moment. So what went wrong? Well, I would sadly say that much of this was very predictable. Firstly, the simulation did not reflect the tooth movements achieved. The technician used these optimized attachments, which I drew your attention to, those little green, small optimized attachments, which were placed towards the mesial incisor edges of those central incisors. And unfortunately, the dentist was never made aware of the fact that actually those types of attachments are likely to achieve closure, but primarily by tipping movements, leaving a huge residual triangle. Now, for those who've got very sharp eyes, if you look in the central region there, you'll notice, I think the dentist attempted to mask some of the triangles by adding composite, which is obviously to a certain degree, providing anesthetic result. But we would all agree that if we could do better than this, we should do better than this. And so additional refinements are required, and the patient naturally was looking for a more optimal outcome. So what could we do differently? Well, firstly, we'd look at this case and say, yes, definitely, there's going to be a challenging amount of movement required. When you close that space in the upper region, you're likely to reduce the overjet and the overbite for this patient. Therefore, you must ensure that the lower arch is being retracted to give you sufficient space. Secondly, we'd focus your attention very, very much on those central incisors and say, look, this is a big ask. So we need to do the very best in terms of not only bringing the crowns of the teeth together, but ideally achieving as much optimal root movement as possible. And these are issues we would help you to consent. So if you look at the planned movement, and just to the top right there, for comparative purposes, I put the optimized attachments that were prescribed for this patient. Look at the difference in these blue attachments on the central incisors. They're very, very long. And the purpose we've gone for long vertical attachments is that they direct the force more towards the crown and root. Therefore, the outcome, as you can see on the right, involves no composite resin additions, and that is a pretty good outcome, I would say, achieved by one of your colleagues. So where does the 32 code fit in this?
So look, guys, our view on this is that the future of dentistry and a lot of healthcare is that clinical excellence is achieved by general clinicians having direct access to the world's best specialists. This is a completely different way of working. I know what it's like to work in primary care, being isolated from the help that you really need to get the best results for patients, especially when you're taking on something that requires a bit of specialist expertise that you just do not have the time to learn in your spare time on weekends and on courses. It doesn't make sense that you are not leveraging the years and years of clinical experience from your specialist colleagues to help you get the best results, especially with the technology that we have available today and have made available to you at 32Co. So what does it feel like when you work with an orthodontist one-to-one and essentially let them do a lot of the heavy lifting? You can understand which cases are suitable. You can avoid those banana skins, so those cases which, they've got some hidden complexity in them that there's no way that you would have foreseen. You can reduce your refinement rates. Refinements are a pain, especially if you're doing high volumes, and really getting that treatment planning process right will really help your profitability as well as patient satisfaction. And really just knowing what's possible, just not over-promising to patients, something that you can't realistically deliver, and getting yourself into that tailspin, and then finally raising the alarm, actually being able to go somewhere where when you've got a problem that you're worried about, getting straight in touch with an orthodontist and actually them helping you through whatever that challenge might be. And that's not all. We focused a lot on the specialist collaboration component of 32Co's method, but actually there's a lot more to it, which some of you may have already heard of if you work with us. But through 32Co, you can also buy aligners from the world's first clear aligner marketplace for wholesale prices. We really believe that access to the best quality aligners should be democratized, and that it doesn't matter whether you're doing one case a year or 100 cases a year, you should have the best prices made available to you. So that's what you get through the clear aligner marketplace. Everything is there for you in one place. So when you've got your treatment plan back, you can choose the aligner package that works for you. You'll get continuous tailored training for free. That's a core of what we offer at 32Co. We believe education is another really big part of building confidence in our clinical colleagues. And then finally, we have our new growth program. So many of you have come on board with us, got over that first half of learning how to do aligners for the first time, and now you're looking to grow your business and really understand how you can maximize this as part of your working life. And we know how much of a difference that makes when you start getting this treatment into your toolkit and being able to offer that to patients no matter where you live. And it really does make a difference. This is a quote from one of your lovely colleagues. 32Co is a journey that I never knew I needed until I got started. I doubled my income, which has allowed me to achieve my 10-year goal of buying a new house this year. And I'm giving my kids the life that I always hoped to. That may seem like an exaggeration, but it really can happen if you commit to delivering this sort of high value treatment that lots of your patients want, lots of your patients need. It can really be life-changing to you, and we're here to help you on that journey. And the results are, I mean, even for us, still pretty mind-blowing. So we're the only aligner company backed by the indemnifiers. Dental Protection, very supportive of this model, as you can imagine. Our average case rating is 4.9 stars out of 5. And dentists tell us that they are to 92% more confident taking aligner cases when they start working with us. And we are 100% recommended by all of our users. So this is the results from thousands of bits of feedback from colleagues just like you. And we would really love for you to be able to experience this for yourself. So if you are interested and you haven't worked with us before, those of you on this webinar, you can sign up to the Case Hospital and get one of your cases checked over and get that Get Well Soon plan over the line. So that's where to go if you've got a case that you're just currently working on and that you're really worried about. But then really, for those of you who want to experience this for yourself and join us for free, you can go to 32co.com, create an account. One of our team will be in touch and get you onto the right program for you. So that's brought us swiftly to the end. We're going to switch over now to audience Q&A.
Okay, so thanks, guys. There's quite a lot of questions coming in. Sonia, first one I can give to you. Someone said you mentioned a partnership with Medical Protection. How does the partnership with Dental Protection work?
Yeah, good question. So about a year ago now, Dental Protection approached us and we had a lot of discussions about risk in clear aligner treatment, especially when people were starting out. So what we've arranged is that any Dental Protection member, when they sign up, they should let us know. And they'll be given priority access to the courses. Obviously, Dental Protection very supportive of anything that helps reduce your risk. So by going through the courses and by really learning how to work with a specialist orthodontist, that's really the core of the partnership with them.
Okay, great. Thank you.
Okay, I'm going to pick some. Okay, so there's actually a lot of clinical questions as well, Ama, which I think you're probably best placed to take. So some on IPR. So how do I know whether I need IPR in a case?
I mean, that's a great question. And I think IPR is a topic in itself. Again, it's something we take you through in the training program, the growth program. How much IPR you need really reflects, it comes back to kind of what I highlighted in some of those cases that have been loaded to the hospital. And that is that it's really space requirement or space relief of crowding issue. We do have certain criteria which we've put into place to help you, one, to train you to acquire some of the skills that you require, but more importantly, to help you plan the IPR. So it could, for example, often, if we think a decent amount of IPR is required, then we might stage it for you. And then we'd engage from the outset and say, look, we need some IPR. We'll prescribe it in a fashion in which you can introduce it to your patient and also execute it throughout treatment. One of the challenges some clinicians have is knowing that they've undertaken the right amount of IPR, because to date, all the literature demonstrates that we tend to underperform, and therefore the reflection is that we sometimes just don't achieve those treatment outcomes. And again, something we'll walk you through on the beginner course or the starter course. So hopefully that starts to answer some of your questions. Sonia, I've got one back for you, actually. I guess this is from a dentist with some experience, because they're asking, if I think a case is relatively simple, do I need to work with a specialist?
Great question. So the simple answer is no. So when we describe the process of working with a specialist, that's a duo case submission. That's you working together. You do also have the option to work solo, which is where you will plan the case yourself and work with a highly skilled technician. So if you are comfortable with the concepts that we described, which is about attachment selection and really understanding the movements that you're prescribing, and that you can actually verify that those are occurring in the plan in the way that you would like, then you can work directly and treatment plan yourself solo. And that's certainly an option that we would encourage you to use if you've got that experience.
And again, Sonia, I might add to that just to reiterate that the technical team is extremely well experienced. So your movements will be planned in a predictable fashion.
This is often something that I think, historically it wasn't well understood, but the technicians that sort of have been brought into the sort of traditional manufacturer landscape tend not to be dentally trained, and they really are relying on some very, very detailed instructions from the prescribing clinician, i.e. the dentist. And so in the absence of that, really, it's not clear what's being presented back to you. And if you don't know how to check it, that's really where the risk occurs. So we've also reduced the risk for you from that perspective as well by really introducing that clinical excellence into the treatment planning process and not cutting corners at that stage. Okay, another clinical question, Ama. This is about overcorrection and whether you would generally whether you generally recommend overcorrection in all of your aligner cases.
Yeah, again, a really, really great question, and one that causes a lot of confusion. So there's two aspects to overcorrection. Typically, overcorrection is something that we may well prescribe in the aligner design, because if we, for example, suspect a rotation is going to cause us some challenges, then we'll tend to get the technical team or the design team to overcorrect constantly, or an extrusive movement, for example, will overcompensate for the amount of movement that's required. Because we know that aligners do predictably produce the tooth movements, but they tend to fall short of the absolute plan. So you do need to make that allowance. The second element is whether you clinically decide to overcorrect. And clearly there could be a concern there, because you wouldn't want to take a tooth which was rotated in one direction and over-rotated to the other. And that's where this misconception sometimes comes, and clinicians shy away from when they're asked by a technician, do you want to overcorrect? So again, this is where we would interject and make that journey much, much more predictable for you. I think there's only these two questions you could possibly take together. The first one is, does it cost money to enroll on the courses? And the second one, as I look down, is how do I get started with 32Co?
Yeah, really straightforward. So firstly, one of the principles is that training that you need to get started is delivered by 32Co for free. So you can join our programs. They tend to be about 4 weeks in duration. A relatively intensive process, as in we want you to make sure that you're covering the content that you need to get that foundational knowledge, or to level up if you're already experienced. So no is the answer. You don't have to pay. And how to sign up. So the link that we shared with you previously is the best way to go. It's just go to the website, www.32co.com, click join us, fill in a really quick form. We verify that you're a real dentist, and then you'll be contacted to start your onboarding journey with us. Okay, I'm actually just looking at the time. In the interest of us doing what's best by our clinicians and giving them their evening back, I think we'll leave it there. We have lots more questions, and if there is something burning that that you would like to ask us or our clinical team, you can always just drop us an email at hello@32co.com. We'll try and get someone to get back to you. But look, thank you for taking the time, and hopefully you've learned something here about how you can take your clear aligner cases to the next level. And hopefully we look forward to seeing you join us in our community very soon.